Assalamu alaikum wa rahmatullahi wa barakatuh. It's an honor to be back in Jeddah for me. I used to live in Jeddah some years back, and because of zoonotic diseases, I had to move to Riyadh. So it's an honor that Dr. Ali did invite me to come here. For me, it's been a learning phase. Most of what I've been listening to since the morning have been clinical. So I come from the public health point of view and infectious diseases. I named the topic as C complex. Basically, most of budgets everywhere in the world for health is dedicated more to clinical medicine rather than prevention. And so I'd just like to ask each and every one of us, why do we have these complexes, and how do these complexes evolve, and how can we have interventions from the public health point of view to be able to prevent diseases like the slides in which we saw Jerry gave us. We keep having drugs and we keep having FDA stumble blocks, but there are other things we can do from the public health perspective that can help us maintain and control diseases that affect humankind and mankind. Again, looking at it from the epidemiological point of view, we need to understand these complexes. I mean, from the Saudi point of view, from the Gulf point of view, and from a global health point of view. I was introduced, when MERS evolved or emerged in 2012, we need to understand where did it come from, okay? And so we need to look at diseases that we are one with the ecosystem, we are one with the ecosystem in which we live in. We need to look at the environment and where it meets to have a disease. We have the agent, and then we have the host. It's simplified in the triangle, but we all exist in it, and we all meet at a particular point. When we have an equilibrium, then we have things steady. But when we have what you call disease spillovers, like happened in 2012, it also happened in 2000 in Jizan, when we had people smuggling sheep into Saudi Arabia, we had Hum al-Wadi al-Mutasaddi. When we have changes in the environment, like we just had flood here in Jeddah, and we had in 2009, and so you'd have diseases emerging based on things like this. So we have this equilibrium, but things that change it, either it's man-made, anthropologic. And so I would just like us to take our mind away from the clinical aspects we've been listening to and ask ourselves about this question. For MERS, we've been hearing a lot about camels and running away from camels. I drink camel milk. I drink pasteurized camel milk, if that makes you happy. I eat camel meat, if that also makes you happy. And I love camel. So cars, we all love our cars. And if you are in Tahliya, in Jeddah, of course, when I was in Jeddah, and Tahliya in Riyadh, Shabab, they come and show off their cars there. And cats, okay? I wrote a big work on cats when I was in Jeddah, and we all know we used to say that time, I don't know about now, we actually have more cats in Jeddah than human beings. I don't know if I'm wrong. Cell phones, okay? And then we have the coronavirus. So they all start with C, and we have our cardiac failure, heart failure, which we've been talking about here. And all of these, they all have in these circles which we saw, and which of these are actually pushing on these to have, and that we need to actually tease out as confounders in this epidemiological myriad. The movement right now is to look at health not from a perspective, it's sort of selfish, human perspective in which we look at our own health, and yet we don't look at how it affects the whole ecosystem in which we live in. In the end, it boomerangs and affects us. And then we have what we call emerging diseases, like you have Ebola around in West Africa, and we have MERS here in Saudi Arabia. So when we look at disease as a continuum, the ecosystem health itself, the health of the animals which we interact with, intentionally or not intentionally, and this cannot happen if those involved, the governments, the stakeholders do not come together, as you see in the triangle there. Looking at this, you have to get surveillance data from the Ministry of Health. You have to get surveillance data from the animal aspects, and you have to bring them together and act. It's like bringing intelligence together, and you act on it to prevent. Because most of what we are dealing with right now, most of the presentations which we have listened to, we are having patients. And that means once we have a patient, we have failed to prevent. One of the doctors mentioned Islamic heart disease. Okay, it's prevalent in Saudi Arabia. I mentioned diabetes. So when we have these risk factors for heart failure, which we're talking about here, but once we don't prevent them, in managing cases of corona also, we have had the greatest risk factors as being diabetes mellitus, hypertension. These are the people that are actually dying. So are they dying from coronavirus? I don't think so. They are dying because these people are already having comorbidities like this, which can be avoided, but which we are not really working on right now. And so this is the boundary, okay? It's a false boundary because we are now, everybody's working in silos, okay? And when it emerges, and it's easy for us as Homo sapiens, we are very nihilistic, and so we can really just face anything. Now it's the camel we're bashing. In America, when the Europeans came there, they took care of all the bisons. They're no longer there. And when the Australians, the whites came to Australia, the Aborigines had to leave. And in Australia right now, they're blaming the camels and they're killing the camels. So we need to look at it from a whole continuum. And so we have to remove the barriers. And we have to look at it as we ourselves, what is our purpose here? We have to look at it as how can we look at it from a non-interventional point of view, which we have to make drugs and go through trials like has been discussed. And then it takes a lot of burden, but there are other behavioral aspects which we can use to control or reduce or even eliminate some of the diseases which we are seeing. But we have to go back to realize that we are created, okay? And we tend as modern men to think that we have control over everything we do and we can do whatever we want to do. If we go back to our roots as Muslims, then we have to realize we are created and we are created for a purpose. Allah khalaqa kulla shay. Khalaqa kulla shay. He has created everything. The camels, which we talked about, and the sand and the desert, which it stays in, and ourselves. And we're not created abatha. We're not created just like that. We're created for a purpose. And we have to understand we are also responsible for this, for everything in the environment. And we have to realize that He also determines. Allah subhanahu wa ta'ala, we have to know that even as, I don't know how many of you are very much involved with what's going on in Australia in the past 3-5 years, where they're actually culling camels because these camels, sort of according to the human perspective, is destroying the ecosystem. But if we just go back down memory lane, it was the camels that built Australia. There can be no Australia today without the camels, because they had to bring the camels in from Afghanistan when there were no roads and when the countryside was inhabitable. And when they finished it, the Australian government actually asked that they should kill the camels. But the camels survived, and the evolutionaries would tell us that no, it survived because the desert designed it to survive. No, Allah subhanahu wa ta'ala designed this animal to survive in that environment. But now, because it threatens, Australia is one of the largest producers of milk and cattle products, and it threatens the cattle. So what are we doing now as Homo sapiens? We're actually just literally they're killing the camels. And we must realize that this in itself will have a boomerang effect on us in the end. Let's come back to Saudi Arabia. In 2012, In 2012, September 20, there was something on ProMed. There's a new virus that was detected. Actually, it was detected less than a kilometer from where we are in Suleiman Faki Hospital by Dr. Zeki. But the gentleman came from Bisha. He had gone to the hospitals there. There was nothing could be done, so he was brought here. His samples were tested. In MOH, it was negative. Dr. Zaki grew the virus, and a new virus was found. And so, October 2, I was called that we have to go to Bisha. He had camels. That's why I used the word confounder there. He had camels. He had 4 camels, and you can see the camels. This is Kevin. He came from New York. He worked with us. But if he had camels and every single person living in the area mixed with these camels, nobody got MERS. Okay? We ate the dates they had there. We didn't get MERS. And so we must look at it as the camel has been demonized, literally because of this. And I mean, from the epidemiological point of view, if the camel had it in that area, he was the only one in his family that had it. He had 3 wives. There were about 40 people in his household. We sat there. We ate there. We went there several times. No one had it. Okay. So we really need to reflect about what we decide or how to label something. That's why I said the word confounder. When we asked the family, do they have bats there? Because the first focus was that it was very similar to SARS, and SARS was from bats. So most people, even most Saudis, which I deal with, don't, especially because we've become too modern, don't even know what a bat is. And when we asked them, Haladaykum shuftum khafafish, they said, no, we've never ever seen a bat. And we waited till around the time of Maghrib, on the 3rd floor of the house, in the house of the late index patient. At time the bats came out, and the bats came out in our front. And so what we have is selection bias and investigation bias, and so we are not teasing out the correct information. Okay? And right here in Jeddah, because I lived in Jeddah, not far from here, we have bats here, la mahala. Okay, we have bats very close to High Khalidiyya. And because most of the urban ecology we created here, especially in Jeddah, there's a particular tree in a place less than a kilometer from here. I don't want to mention the name of the place so that people don't go there. But basically, I had an American friend there. The bats were literally a pest. So they were really living with people. It's not far away from here. King Fahd General Hospital, the ecology there supports bats. A Saudi lady did her MSc project on bats in Jeddah. And so it's not something that it's out of the spook. One of the hospitals not too far from here, about 4 hours drive from here, had bats literally around the hospital. I mean, I've been around at least 4 or 5 hospitals and we've seen bats moving. And so this is the current status which we have here right now. We have less than 550 people dead from 4 years. Now, if we follow what's going on in the newspaper, especially when it first came, it was like, and that's why actually I think I was sent there, because I could take all the shots. People were literally afraid of dying. And if we are to follow what we listen, and most people still drinking, living, eating, sleeping with camels, in the Hadir Adair, a lot of us, including myself, will not be here. And so we need to look at, is it just because the camel is the largest mammal in Saudi Arabia, okay? And it is an animal that can take everything. It is built to take everything. So just like because you find an animal having a virus, it doesn't mean it is the one spreading the virus. Because if I take swabs from a lot of us here, I can find maybe H1N1, I find maybe even rhinovirus. So it doesn't mean that I am the source or I am the anitarzine of this virus. So this is the current state. If you look at the number of deaths and if you now compare it to SARS, and then we now compare the fear that has been generated, we see that this virus is not as dangerous as it is. This is the very first thing. And if we are doing aggressive testing, Now, we are still based on PCR testing. If we are doing aggressive testing, we are doing serological testing, and we are also doing PCR serial testing. We will get a denominator in which is high, and then we'll get a small number of deaths, and the case fatality rates will come down, and then the scale will also go. Now, one of the things about the camel that has been demonized is it's also very shocking that this country, literally, it was camel that brought Malik Abdulaziz back from Kuwait when he took over Riyadh. If any of you have visited Riyadh and you visited Masmak, which is a place I love to visit and I take tourists to in Riyadh, he came by camel's back. They survived on this animal. And this is a camel carrying a car in India. No animal can do this. So, but when we go to the reality in terms of how we interact and how people are interacting daily with it till today, and the numbers we are getting, it's nothing compared to what we have in SARS. And most of the transmission has always been in hospital, just like we have the study by the doctors from KFMC. Most of the transmission has been in hospital. It's not been outside. And so that's infection control problem. Now this camel, just to show you, I brought this to make a point. This camel, the car hit the camel or the camel hit the car, it's your choice. Which came first, the chicken or the egg? But the thing is, the animal survived. And but as human beings, we always look at we are the ones that are correct and they are not correct. And we have this problem in Saudi Arabia where camels are all more than often than not involved in accidents. So do we blame the camel like this? And this article is doing 97%. I find that very hard to believe. I love driving in Saudi Arabia. I love driving long journeys in Saudi Arabia. I've driven to Farsan Islands from Riyadh. And I know how it is. But if we are driving correctly, who owns the road? We say, no, we own the road, the camel owns the road. Again, this is behavioral. My car has almost entered a camel before, I'll be honest with you. Okay, but then it has to do with our concentration on the road. Because the animal, like if you study the anatomy of the camel, it has a high center of gravity. And so when you come and you're not concentrating on the road and you clear the forelegs, it's going to end up on the car and you'll see cervical injuries, as has been recorded. Now, these are some of the animals which we interact with. This dog is from Buraida. Okay, most of the people in Saudi say we don't have dogs in Saudi Arabia. That's a dream. When I first came here in 1991, I thought there are no dogs too. I was dreaming. We have dogs everywhere. In Riyadh, in my area, we have dogs crossing when we finish the Salatul Fajr in the morning. And this dog was, you can see it is very fat. It was feeding on one of the maslach in Buraida. This was like in 2010. And so we have rabies also. But we're not diagnosing, we have rabies. In Buraida, we had a study showing that we had more cats being positive for rabies than if we didn't have dogs. We had goats, we have camels. And so, but we're not diagnosing because especially human rabies, if somebody were to die, what happens to him, we don't do post-mortem. And so we don't have a post-mortem, we don't have a lab diagnosis. And so we don't have a lab diagnosis in epidemiology, we don't have a case. And so it's like we're underreported, but we definitely have cos-fox, a thalab, which is the main reservoir of rabies in Saudi Arabia. It's abundant. We have it in Jove. And I just got a video in which boys were actually cutting up a dead wolf. They were cutting it up live with blood and going into the liver and eating the liver, actually. And so the interaction, and what happens is when these people present to the clinician in the hospital, the clinician has to take his history. I mean, how many clinicians will ask you, and when last did you go and hunt a fox? Okay? And I know somebody who hunted a fox, actually, and he got bitten by the fox, and he wasn't even given the rabies vaccines, which is available free in this country. And so, we have to be able to wake up and be able to know that we need to intervene where behavioral patterns matter. And that's why we see these pictures just to wake ourselves up. And you can see that cat there. I mean, I have a son, and most of us that have children, what happens is our children will go and play with the cat. And they will come back home with dirty hands, and the mother will take the dirty, will try to hold him, and you don't know what he's carrying because the feces is all around. Toxoplasmosis is endemic in Saudi Arabia, and we have almost zero control about it. And that's because we have too much cats. Now, I was talking about bats. These are bats from all over Saudi Arabia. I mean, this is me. We're in Bisha. Okay, we have a food bat in my hand, and this bat is from about 200 kilometers outside Riyadh, going past Al-Kharj. And the bicycle there, you can see there's a bat hanging on the bicycle there. Okay, that bat is dying because about 2 years ago, in 2013, we had an extreme heat wave in Kumfuda. That's Kumfuda. We had an extreme heat wave, and the bats were literally dying. Okay, they were literally dying. The cleaners had to put bats, almost four bags of four garbage bags, and fill it with bats. But this is not reported, and so but this is how diseases emerge. Okay, this is how, because they had a contact. This bat was close to a cafeteria where people were eating. Now, this one, it was very interesting. I was doing inspection in a hospital. I'm not going to mention the name of the hospital. This is a hospital, okay? And this is an infection control mayhem, okay? And so, for me, the cats are the number one danger for biosecurity in any hospital in this country, okay? This is a hospital, and the cat is sleeping on a linen, and the tray there is for food. Just to show you how cats, they are very, 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 you'd see this video and how it's going to open the door and go inside itself. It's a serious biosecurity hazard we have here. And so you have to think, because this animal can carry everything. Rift Valley fever, rabies, toxoplasmosis, leptospirosis, this animal can carry anything. And we've known places where it actually entered the air conditioner system and actually it urinated there. And it goes all around. And so we need to know the system. This is Jeddah, okay? And Jeddah, I used to think Jeddah was very big before I went to Riyadh. I was dreaming. Riyadh is quite bigger. But that time, I made this slide when I was in Jeddah, and it's still very current. That time, we must realize that without controlling the animal interface, okay, and without controlling the animal interface, and without making effort to change the behavioral attitude, then we would have increase in diseases emerging. But if the clinicians, like the clinicians are here, if we are not quick at recognizing, then we'll have underreporting. Going back to the situation with the heart failure, Rasulullah sallallahu alaihi wasallam told us in a very long in a long hadith, وَإِنَّ فِي الْجَسَدِ الْمُضْغَةِ, we talked about the heart here. If it is sound, then the whole body is okay. And the little I know about heart failure is if you have heart failure, it can lead to congestion in the pulmonary system and then affect the whole system, affect the renal system. But if it is okay, the whole body is okay. And we have been given this heart as, that's the transition there. We have been given this heart as a ni'mah from Allah Azza wa Jal, which we should try to actually use properly. And one of the two things which behaviorally we can control, we have smoking, and we have smoking, which is a big problem here, and we have diabetes mellitus, things which we can control by lowering a lot of the things which we eat, like we would drink, like a soda and like smoking. But when we move it away from the C complex, which I talked about, we look at cars, okay? We have more car accidents in Saudi Arabia, which we need to look at how to really control it. Is it more dangerous than corona? This is the question I'm asking. Which is more dangerous? I mean, if I had my way, I wouldn't drive in Riyadh, but I don't have a choice. Okay, so we have like 7,000 deaths on the road alone. This is just for 1 year in 2012. So can we compare this to the deaths which we've had for corona or any other disease? Okay, and now we've added to it, whether it's a confounder or not, we've added to it cell phones. I mean, you can imagine I've been in a car, the guy is receiving his BlackBerry message, is going at 160, and I'm thinking my wife is waiting for me at home. So really, we have this, and it's not being controlled. So we can ask ourselves these questions as a take-home message. Which ones? We can't ban cars, we can't ban cell phones, we don't ban cigarettes, okay? But we tell people not to drink camel milk. Does it really make sense? Which is killing more? And camel milk is 100% recommended by Prophet Muhammad sallallahu alaihi wasallam. Wa fi albaniha wa fi abwaliha. So, and there's nothing, he says that is nothing but correct. But the ones that are really doing us harm and which we can really reduce, cigarettes has absolutely no benefit. Absolutely no benefit. And so, this is my favorite. It's camel milk. If you ever come to Riyadh, I'll take you where you can get it. Okay? But I'm forced to, even in the hospital where I work, when I go out, I have to go out. If you pass somebody smoking, or even he comes into the mosque after taking a shot, it's really, really terrible. And so my message is for us to look at the C complex and see how we can really intervene, how we can decide for ourselves which one we can do that. And with all of this, we don't need any FDA approval. The Quran is approved. It doesn't change. The guideline remains the same. And one way in which we can actually help ourselves, especially those of us, I mean, I work with doctors, and it is very sad that most of the doctors are the ones smoking. So, and I mean, we did a survey in Ta'if, and the children, this is a mutawasit, and they were asked about smoking. They said, why should we stop smoking when you doctors are smoking? And so, I mean, the muggers are mugging the muggers. That's what they say in the US, right? So we need to look at the broad perspective, because for those who smoke and you cause your wife to have to have breast cancer because she's forced to stay with you, and the driver that is driving you now has cancer when he goes back, we're going to actually pay the price in the next life because we led to him being ill. So we need to look at the broad perspective. And more importantly, most of us who are clinicians, we really need to go into epidemiology, because epidemiology helps us to look outside the clinical aspect. I'm working with a clinician right now, and we're so happy that we're trying to look at diseases in the society before it comes. We have respiratory viruses, just like the study by Dr. Wahid. It's an in-hospital-based study, but we need to look at it, how it happens in the community before it's presented to the community. Thank you.
Thank you very much. So 5 minutes, we'll